Parkwood Institute Outpatient Acquired Brain Injury Program.
Our team has been working with the issue of concussions, and we've really struggled to keep up with the demand for our services. Because we're not afraid to try new things and we're not afraid to challenge each other, we started chipping away at the problem. The numbers for brain injury are big. About 1.5 million people in Ontario live with a brain injury. Of those, the mild traumatic brain injury is about 80%. And then of the mild traumatic brain injury, about 20% of those patients suffer with persistent symptoms.
There's been a great demand for the services on this outpatient acquired brain injury team. These are patients in our community who often have something going on that's invisible to many people. This team finds ways to help them return to work, help them return to school, help them return to a more productive daily life.
So to try to figure out how we can try to help these patients, we've been forced to be very innovative and do things like create a website where we can get some of the information out to people who don't live nearby or are unable to access our program. We've created a lot of different groups to try to be as efficient with our resources. We have groups like our ABI 101, which is our education group that people either visit or watch online while they're waiting for service. One of our other groups we've called Brain X 90, which really stands for Brain Exercises for 90 Minutes, and that's our circuit training group. It's an occupational therapy and physiotherapy group where patients rotate around to different stations doing vision exercises, vestibular exercises, balance, cognitive. And what's been so great about all the groups that we've done is time and again, patients tell us how helpful it is for them to be with people that have the same issues. So they don't feel like they're alone, they don't feel isolated, and they feel they have a support network. I think we're providing a unique service for patients with persistent symptoms. We have patients that tell us, this is the first time I've had someone that actually spoke to me in the language of concussion. We also hear from across the country where other programs are either using our website or coming to visit us, trying to implement some of the stuff that we've done and trying to take our program and use our strategies within their program across the province and across the country.
This is a highly dynamic team that's focused on excellence in the patients that they serve. This is one of our core values of the organization is excellence, and this team demonstrates it every day.
Our team is small but mighty. We are able to take and solve our own problems. We get support from our leadership, but we're able to creatively problem solve and try to figure out what works both for us as a team, but most importantly for our patients that we work with to try to help give them the service that they need.